Good afternoon. My name is Clementine Oki, a registered nurse working at the National Rehabilitation Hospital. I am a DMP student at Brandman University. Today, I will be presenting a video on Stakeholder Education Plan on Preventing Falls in the Hospital. The National Rehabilitation Hospital is a small hospital of about 120 beds dealing with traumatic brain injury, cardiac, orthopedic, and spinal cord patients. This project is a quality improvement program whose goal is to reduce falls, improve patient safety, and increase patient satisfaction. Background and significance of the problem. Falls are a common occurrence in hospitals in the United States and around the world. A fall is an unintentional occurrence that causes a victim to rest on the floor or close to the floor unexpectedly. About 700,000 to 1 million falls occur yearly in hospitals in the United States. About one-third of hospitalized adults older than 65 experience a fall every year. A fall episode will cause physical, psychological, and economic effects on the victim. A fall in the hospital will lead to damages ranging from minor to drastic, leading to a surge in hospital expenditure. Hospitals in the United States spend close to about $58.27 billion on fatal falls with harm every year. With the increased economic burden caused by falls and the goal to reduce its occurrence, the Centers for Medicare and Medicaid Services made it compulsory for the institution to take care of expenses caused by falls while in the institution. This project in a Picot format will read as follows. For hospitalized adults at risk for falls, with the use of purposeful hourly rounding compared to usual care, lead to a reduction of falls within 8 weeks. Fall prevention in the hospital is everyone's responsibility. The stakeholders for this project will include the nursing administrators, the unit managers, the quality improvement team, the pharmacists, the therapists, the providers, the educators, the information technology, housekeeping and maintenance, the phlebotomists, the medical assistants, the nurses, the patient, and the family. Each stakeholder has a role in preventing falls in the hospital. The quality improvement team will utilize quality improvement instruments to promote individual fall prevention plans to decrease falls in the hospital. The nursing administrators, although not physically present on the ground, they are responsible for providing necessary resources to prevent falls in the hospital. The pharmacist will review the patient's medication profile to determine which drugs could trigger a fall and suggest a substitute drug to the healthcare provider. The unit managers will make sure the nursing staff is compliant with fall prevention protocols. They are also responsible to provide monthly updates of fall episodes in the unit. The therapists are responsible for assessing each patient and providing exercises to enhance their ability to carry out their activities of daily living safely. Healthcare provider reviews the patient's chart and orders individual interventions to prevent falls. The nurse educators provide old and new employees with recent evidence-based information to prevent falls. Information technology is responsible for installing innovations aimed at preventing falls in the hospital. The medical assistant assesses the patient's surroundings during care and reports any potential risks to the nurse. The frontline nurses are the main actors to prevent falls. From admission, these nurses evaluate the patient's fall risks, document and report any potential threats to the healthcare provider for interventions. The nurses are also responsible to educate patients and their families on the hospital's fall protocols. In an event of a fall, the nurses document a PSE, which is a patient safety event document, and they are expected to conduct a post-fall huddle with the team. The housekeeping and maintenance personnel are responsible for keeping the surroundings clean, clear, dry, and repair any damaged equipment that could lead to a fall. The patient and the family are expected to follow the hospital's fall prevention strategies. They are also responsible to communicate any potential hazards to the nurse. The phlebotomist is expected to lower the patient's bed after drawing blood specimen. They are also entitled to report any potential hazards to the team, and the kitchen personnel who come to the patient's room at least 3 times a day for food delivery is expected to survey the surrounding and report any potential fall risks to the nurse. Theoretical and conceptual frameworks are systemized concepts formulated to guide a research project. I have adopted the Kirk-Lewin's change model for my DMP scholarly project. Change in clinical practice is inevitable. Employees are always resistant and scared to part from their traditional ways of practice, but on the contrary, the healthcare settings are required to replicate their surroundings that change frequently to maintain stability and hold on. The Lewin's change model has been utilized as a tool by many quality improvement teams to modify clinical practice at the bedside to improve patient safety and quality of care. This model has 3 steps: the unfreezing phase, the changing, and the refreezing phase. The unfreezing phase. This is when the organization recognizes an issue with the current practice that needs to be changed. With my current project, there is a problem with how the staff conducts hourly rounding, which demands a change in practice. The changing and moving phase. This phase deals with looking for different ways of practice to modify current practice through education and training. I will educate the staff on how to do hourly rounding in a structured manner. The refreezing phase. This phase implements the new way into the organization, making it the standard practice, and inhibits future change by monitoring key performance indicators, re-educate whenever necessary, and observe outcomes. Before proceeding with the project, I will identify the educational needs of the stakeholders. Firstly, I will recognize the stakeholders in the hospital. I will evaluate their significance to the achievement of the project. I will evaluate their eagerness in the project. I will ascertain how to attract them in the project. I will ensure the stakeholders accept to participate in the project. I will also make stakeholders to understand that 2 in 5 adverse events that occur in the hospitals are false, and that a fall, particularly with damages, will lead to more days in the hospital. An extra cost between $11,000 to $14,000 will be spent on a fall episode. An occurrence of a fall will slow the healing process and the rehabilitation process of the victim. Therefore, preventing falls will reduce fall rates, improve patient safety, and rehabilitation outcome. Then I will proceed with the actual plan of the project. After identifying the problem and assessing gaps in practice, I will meet with the administrators, the managers, the quality improvement team, and the nurse educators to inform them about my proposed project and its importance to the hospital. I will carry out a presentation about the project to be attended by stakeholders. Flyers about preventing falls will be posted and distributed in the unit. Questionnaires on staff perception about hourly rounding will be distributed for their feedbacks. The entire project will be within 8 weeks. I will visit every unit. I will visit the hospital every 2 weeks for feedbacks, motivation, and reinforcement. The data on pre-intervention and post-intervention will be interpreted and analyzed at the end of the project. The method of communication for this project will be through face-to-face, emails, and Zoom as needed. To sum it all, a fall is a frequent problem experienced in hospitals in the United States and around the world. Despite its numerous ways to prevent it, the National Rehabilitation Hospital is not an exception. It takes a combined effort from all team members to prevent a fall from occurring. Therefore, educating the team and increasing their awareness of new ways of practice will lead to a reduction of falls, improve patient safety, and quality of care. Thank you for listening, and I am open for any questions or comments concerning this project. Thank you again. Bye.